Hey everyone. Okay, since I haven't done any videos in a while, I'm going to catch up real quickly. I'm going to go through some of my older posts and we'll go over the coronavirus. And then I want to get into some numbers. Okay, so scrolling back. Okay, I'm sure you've all heard about the patents with the virus. And I'm sure at this point you have all seen at least the trailer for Pandemic that's on Netflix that conveniently aired in the midst of all this. And you probably have already seen the information about the lab in Wuhan also. So inside the Chinese lab, poised to study world's most dangerous pathogens, and the Washington Times says coronavirus may have originated in the lab linked to China's biowarfare program. I'm also sure that by now you all know about Event 201. Health experts issued an ominous warning about a coronavirus pandemic 3 months ago. Their simulations showed it could kill 65 million people. Event 201. The Johns Hopkins Center for Health Security, in partnership with the World Economic Forum and the Bill and Melinda Gates Foundation, hosted Event 201, a high-level pandemic exercise on October 18, 2019, in New York City. It's also good to note that John Hopkins is the one that had the coronavirus tracking map up and running first. They just recently simulated this exact scenario and had a map out in no time. Okay, so the Event 201 scenario from October 2019 from their website says Event 201 simulates an outbreak of novel coronavirus transmitted from bats to pigs to people that eventually becomes transmissible from person to person, leading to a severe pandemic. As the cases and deaths accumulate, the economic and societal consequences become increasingly severe. The scenario ends at the 18-month point with 65 million deaths. So that's Bill Gates and the one that had the coronavirus tracking map up and ready. That tells you something. That's very convenient timing of the simulation for the coronavirus. Now we know this is a new strain. Coronavirus has been around, but this is a new strain of coronavirus. Okay, so scrolling back again to touch on some of my older posts. Okay, we know this can take at least 14 days to show symptoms, and you could be spreading it the whole time, right? So you might not show any symptoms, might not even know you're sick, and you are contagious. They have confirmed that. Okay, so about 9 days ago, it was reported that 21 students and 5 chaperones arrived just 2 days before that for a school and cultural exchange. They go on to say how they will keep the kids from school, but then they say the students will not be visiting the school, but, and I quote, "We will offer to work collaboratively with the travel company to facilitate cultural and educational activities in the DC area so that students can enjoy a positive experience." So yeah, that means they could be contagious and they're out doing educational activities in the DC area. So that's just crazy to me. I don't know. So watch DC area also. Okay, this was also weird. It said coronavirus concerns prompts Southwest Airlines to remove sick passenger from flight. Okay, so that part's not so weird. But then later I noticed a news video on the matter and it was weird. That part was weird. Okay, so they were talking about giving this guy pills, but they wouldn't tell him what they were. So here, I'm going to play that clip. Listen to that clip.
Immediately the flight attendant said, "He's running a fever. He shouldn't even be flying right now."
Rose says the flight attendant went to the front, shut the curtain behind her, and began talking to people on the ground via headset.
He kept putting his head on the seat and kind of leaning back like he wasn't feeling good.
Shortly after, the attendant came back with a handful of pills.
And the lady said, "My husband's not going to take these." And she says, "No, you will take them. Otherwise, this plane is landing right now." It was scary because they didn't even tell him what he was taking. So that was kind of weird.
Eventually, he did take the pills, while the flight attendant took down passport and travel information.
But when we landed, there was ambulances, police.
The plane stopped before it ever got to the terminal.
But there was also a gentleman with whole hazmat suits waiting for him when he got off the plane and took him in the ambulance.
They got the sick man and his wife off the plane first, then held everyone else while the airport doctor was patched into the intercom.
As you know, we had someone who was sick on the aircraft, which is not uncommon. Because of this heightened time, we're just using an abundance of caution.
Rhodes seen coronavirus in the news, but
I really never thought about it until today.
so we have been following up on this pretty much all afternoon. So Southwest Airlines got back to us confirming medical staff met this flight as soon as it landed there in Baltimore. Here's part of what they had to say. They said, out of an abundance of caution and in light of the recent concerns of the coronavirus, our crew followed recommendations from the Center for Disease Control for responding to concerns to ensure customers and those traveling with them receive assistance and support that they may need. Now, we also reached out to the Maryland Department of Health. They told us that passengers had recently been in China, the one that got sick, but they also added this: the person did not meet the Centers for Disease Control and Prevention criteria for 2019 coronavirus testing, but was referred to a medical facility for evaluation to determine whether additional follow-ups were necessary. It continues to say, per guidance from the CDC, no special action was indicated for this person or for any other passengers or crew on the flight. Following evaluation by medical personnel, that person was released. So it appears to be an all clear for now, but passengers were told they'd be contacted if anything changes. Meanwhile,
See, I wonder what kind of pills they gave him. What was that? But if that isn't weird, then get this. They said he did not meet the CDC criteria to be tested. So just think of how many people could be walking around here that could have it now and can't be tested because they don't know that they've been in contact with somebody that's been in Wuhan, China. So let's get over that. I don't understand that, how it's person to person, but you have to have traveled there. Okay, let me go over the strict CDC criteria for you to even be allowed to be tested, and keep this in mind. Okay, the people that are being tested in your states have to have traveled to Wuhan, China within the last 14 days or been in close contact with someone who has traveled to Wuhan in the last 14 days and is already under investigation. Plus, you have to show fever or symptoms of a respiratory illness, of course. So if you haven't been to Wuhan, China, or been around someone who has and is already under investigation, you aren't being tested. Coronavirus is spread from person to person. So if someone else gave it to you and you never even knew they had it, because people can spread it without showing any symptoms, you still aren't going to be tested because you don't know that that the other person had even been to China. So what if, I don't know, to me, if it's person to person, I figured they would test you if you have symptoms because it can spread to, this person and this person, and you would never even know you came into contact with somebody. Those are pretty strict guidelines or criteria. But anyways, okay. Now we know person to person has already been confirmed, and now it's been confirmed right here in the U.S. I think that makes 4 places that it's confirmed person to person outside of China. So I personally believe that the CDC guidelines and criteria for testing is useless. I do understand that they are running out of test kits in China, but this is just crazy. Okay, so speaking of being low on test kits, the numbers don't add up. They have a lot of hospital beds, and even when they only had 1,000 people infected, they said they were overcrowded and overwhelmed. So one of them, the hospital, if you look it up, it holds like 3,900 beds. The math just doesn't add up. But add this other stuff to the equation. But warning, this next part is very difficult to see. If you can't handle difficult things, please turn it now. And the only reason why I'm sharing these, or all this, is to show you a little bit of what's really truly going on over there, because our media is really downplaying it. Okay, infected people seen in the streets. People are collapsing in the streets. People are walking around just seeing people laying in the streets. The death count is much higher. So that comes from people over there before they were silenced, like whistleblower healthcare workers and people just filming. Also, Chinese nurse says corpses of coronavirus victims are left laying in the Wuhan hospital, crammed with patients, as she warns everyone will end up being infected. Just think, that was 8 days ago. What's it like there now? People are being turned away, and a lot of people are dying in their homes. Oh, I hate that. You have claims from tons of people over there before they got shut down from being able to speak that bodies are being thrown in incinerators and not counted. Even some news sources are finally starting to pick up on this news. For example, Yahoo News. China accused of cremating bodies in secret as coronavirus patients' numbers spike. Journalists had interviewed people working at local cremation centers. The sources confirmed many dead bodies were sent directly from hospitals to the cremation centers without properly identifying these patients, which means there are patients who died from the virus but not adding to the official record. We now have mainstream saying things like this from The Guardian. 100,000 may already be infected, experts warn. Or Yahoo, there is 10 times as many coronavirus cases in China than what's being reported, analyst says. Also, our former FDA chief worries that China could be underestimating coronavirus cases by tens of thousands. Okay, so let's watch this clip real quick.
This is a quote from an ex-FDA chief about this. He worries that China could be underestimating coronavirus cases by tens of thousands. His quote, "I think we're dramatically underestimating cases in China by tens of thousands. I think the Chinese haven't been fully sharing."
And then you have this from Dr. Eric Dean. My response to some people who think I'm trying to stoke fear. I'm a Harvard-trained scientist with a doctorate in epidemiology and the youngest dual doctoral grad from Harvard, SPH. I remember SARS, MERS, avian flu, TB, Ebola, and lots of other recent epidemics. I've been on TV for all of the outbreaks in the last 10 years, and never once have I ever pulled the panic alarm and been this concerned. Until now. Data only indicates it'll get much worse. Okay, so also a virologist, sorry, I can never pronounce words on here, sorry guys. Okay, who helped identify SARS. So he helped identify SARS, and he's talking about coronavirus. I've never felt scared. This time I'm scared. I've seen it all. Bird flu, SARS, influenza A, swine fever, and the rest, but the Wuhan phenomena makes me feel extremely powerless. Most of the past epidemics were controllable, but this time I'm petrified. Those are strong words from, people that their opinion matters. They were never worried before, but they're worried now. Okay, so even though the future numbers look alarming, it's not just the fatality rate that is the main concern right now, although that's bad enough. We have to take absolutely everything into consideration, from the economy taking a hard hit to the hospitals being overwhelmed and overloaded. So we are taking into consideration the R-Naught and the percent of people hospitalized. If you take that into consideration, which we're about to cover in a minute, but if you take that into consideration, imagine what happens when this many people end up in the hospital for a month. The fatality rate is not the main issue at this point in time, but it's bad enough. Some of the main concerns right now for me is the impact this will have globally and on our economy, as well as the hospitals, etc., like being overwhelmed and overcrowded, overloaded. And also the fatality rate. This all is up there for me. If it was to spread like that here, our hospitals wouldn't be able to keep up. Just think about how that type of situation would play out here in the U.S. Okay, so let's go over the R-Naught and why I've been concerned from the very start. This is very important that you watch this part to understand this. It is the basic reproduction number. This also helps determine whether or not an infectious disease can spread through a population. If it has an R-Naught of 0, it will likely fizzle out. But look at these numbers though. And credit to Chris Martenson with Peak Prosperity for putting this chart table together to help explain this to everyone. Now you can find the full video at the bottom. I'll link it there. And please watch it and give him a thumbs up and subscribe to him.
A couple of tables here so we can just sort of compare things. Remember, an R-Naught is asking this question. If during the entire time that I have, and I'm infective with a certain virus, what is the chance that I'm going to spread it and to how many people? Right? So if I have an R-Naught of 1, in this case we're looking at an R-Naught of 1 here, if during my infective cycle, I might pass it to one other person. So now 2 people have had it, me and the other person. And then they have an R-Naught of 1 as well, and so, or the virus does, and then they pass it to one person. So there's 3 people have had it total, cumulatively. Me, the next person, the next person. So with an R-Naught of 1, this thing can persist through, and after 10 hops, after we've gone through 10 of these infective cycles, you have about 11 people. That's what an R-Naught of 1 does. It neither really, it doesn't grow through the population, but it persists. So that's with an R-Naught of 1. And what's important to note is the flu. The flu that CNN was just so proudly proclaiming is the same, or even more deadly, or something you should worry about more than the coronavirus. That has an R-Naught of 1.28, which means, and I don't have decimal points in here, so these are all rounded numbers. But look what happens even when we bump from 1 to 1.28. By the end of 10 hops, now there's 15 people. So this is growing, it's persisting and actually growing a little bit, spreading through the population. That's what 1 to 1.28 does it. Now, this is why it's really critical. What do you think happens when we get Spanish flu as an R-Naught of 1.8? I'm going to bump this next table to 2. Here's what happens when we go to an R-Naught of 2. Ooh, all of a sudden, because you go here in the first cycle, it gets spread to 4, it gets spread to 8, it gets spread to 16, it gets spread to 32, and by the end of this, by 10 hops, now 2,048 people have been or are currently infected, compared to 15 in 11. That's what the R-Naught is doing for you. Now let's ask the question, though, what happens if we ran that out to, say, 20 hops? Where does that take us? All right, sorry, this got clipped off a little bit on the side, but 20 hops means that we had R-Naught of 1, you got to 20, and R-Naught of 1.28, you get to 178, and an R-Naught of 2, and you get to 2,097,152. So what happens now when we take that to an R-Naught of 2.5, which is where we think this coronavirus is? Well, interesting numbers. By the 10th hop, we are now at 23,000 people compared to 2,000 compared to 15. So this 15 to this 23,842, that's what CNN wants you to believe is a comparable statistic. They're comparing a virus where we have herd immunity and which has an R-Naught of 1.28 against a brand new virus with no herd immunity with at least a minimum R-Naught of 2.5. They're comparing 15 to 23,842. And if we jump that out to 20 hops, what happens? Well, now, after the 20th hop, we have 227 million and change people that have been infected compared to that 178. So that's just ridiculous. Just ridiculous for CNN to compare that.
Okay, so now let's see the other part to this. This chart is counting only confirmed deaths. This is not taking into consideration the Yahoo News articles, the healthcare workers in China, and the journalists all saying that many dead bodies were sent directly from hospitals to the cremation centers without properly identifying these patients, which means they are patients who died from the virus but not added to the official record. But for the confirmed cases only, everyone that was saying SARS and swine flu of 2009 was worse than this new coronavirus. See the chart. Okay, it's just starting. This is only the beginning. No one gave it time. They just checked current numbers. But we have been focusing on the R-Naught of 2+, which is very alarming. But here you can see this chart alone with coronavirus standing up against SARS and swine flu. Coronavirus has a much more steep incline. This is only the beginning. Without intervention measures in place, this will likely continue on trend and continue to rise. Even with intervention measures in place, we are finding it hard to contain. Hopefully it will slow the numbers down some. Here is a look at the numbers data. Okay, so this is his numbers data if it were to keep on trend. Okay, so note that we need to remember that these numbers are not taking into consideration intervention measures. Intervention measures could slow the numbers down. Okay, so now here is a computer simulation model. It's numbers. Okay, sorry. So let me grab that. Okay, I've been following it closely also. Like I said before, with the intervention measures, the numbers could slow, but the true numbers are pretty high. So we need to take into consideration the number of people they are treating and that they suspect is infected with the virus, but not yet confirmed because of shortage in test kits and rate at which they can test. We have to trust that enough test kits were in place. The people who are actually infected has not all been tested. So that's why they have started putting out a suspected cases number. All we are tracking at this point with the coronavirus confirmed cases numbers is how fast China can ramp up their testing. So the computer simulation just accounts for the number of infected, So let's take a look at the number of infected and the number of suspected cases. Okay, so this data would fit the simulation. It would actually be higher. This is last night's data, by the way. New numbers will come in this evening, and I'll do a comment with updated information. But the latest data shows 9,928 confirmed cases and 15,238 suspected cases. So far, the fatality rate outweighs the recovery rate. So far. Many people are still in the hospital, so we just don't know yet. It's just too soon. Okay, so I post updates on Facebook and Patreon a lot, but Facebook is about to crack down on coronavirus information. So Facebook says it will start removing content with false claims or conspiracy theories about coronavirus. Facebook is supporting their work in several ways, most especially by working to limit the spread of misinformation and harmful content about the virus and connecting people to harmful information. We will also block to restrict hashtags used to spread misinformation on Instagram, and are conducting proactive sweeps to find and remove as much of this content as we can. So that's that. Okay, other things I need to note would be that the World Health Organization declared a global health emergency yesterday. Airlines like Delta and American Airlines are suspending flights to China. The UK and Russia are also reporting their first cases, and Italy has declared a state of emergency for 6 months due to coronavirus. So far, the Dow is down 479 points. And I also just saw that this pop up. We are taking precautions to prevent spread of coronavirus, including simulation drills to prepare our staff to identify patients who may have been exposed. Okay, and some find this picture weird also. I don't know if you're into that conspiracy stuff or not, but it is pretty weird. Okay, so you see that, read that. Okay, I guess that's all I'm going to do today with this update, because I've already made the video way too long, but I hope you get a good idea of kind of what's going on out there. I'm going to show some more clips at the end of this of ones that are being shared from out over there. I can't confirm that, but that's just what's coming out from over there before they were shut down and not really sending much anymore out. But it's alarming and hard to watch, so I'm putting a warning on that. If you don't think you can watch it, don't watch it. There's people being welded into their homes. I don't know, it's bad. Okay, so also, I posted this on my YouTube community tab page and on Facebook on January 13th. And this was not the reason. The coronavirus was not the reason, but it was just some urgency I felt. And y'all probably remember this post, but it says, "It's really time for us to step up our prepping. When you go to the store, buy extras. On a budget, you can check places like Dollar Tree for some prepping stuff. They have all kinds of cool stuff. Thrift stores have good finds. Ramp up prepping on food, water, sanitary items, emergency items, first aid, seeds, home library, etc. So get spiritually prepared, mentally and emotionally prepared, and physically prepared. Step up prep. I put step up prepping now, please. I've got an urgency in my spirit to warn others to start to ramp up prepping now. Don't be scared, just be prepared." And I'm not doing this to panic anybody. I don't want anybody. Okay, well, I had to come back on and edit this in. I was done with the video. But Chris just uploaded a video with peak prosperity, the ones I've been showing, the graph, the chart, all that. This is alarming. There's a study coming out that says the RO value that we talked about, the knot, is at 4. I don't know. That's a little high. I don't know. I'm going to play some of that, and then I'm going to link that also in the bottom. I don't want to play it all and take that from him, but I do want to play a little bit of it, and all the credit goes to him. It's there. Go watch it. Subscribe to him. He's right on the money.
Hi, I'm Dr. Chris Martenson of Peak Prosperity. I'm here with the most important update out of all of the coronavirus series that we've done so far. It's January 31st, 2020, and I've just come across a study that puts the R-Naught of the coronavirus at over 4. Well, let's call it 4. Anything in that zone is just going to be absolutely unbelievably hard to stop, impossible to stop, I would say. Listen, this is data that I'm not here to try and make you fearful. I'm not trying to whoop up any panic or all these things that I'm sometimes accused of. What I'm trying to do is bring you the information that you need
because this is information that you have to begin to plan around. This is information that's changing how I'm responding to things and the kinds of preparations I'm undertaking, and you need to have it as well. So that's my commitment to you, is to bring you the data.
Good morning, everyone. Chris Martenson, 9 o'clock in the morning on January 31st, 2020, and I've come across this research paper out of China using modeled data and actual data out of the clinical settings to estimate that the R-Naught for the coronavirus is 4.08, and it's not that precise. Of course, it's got a mean estimate around it, a standard deviation, but that's the mean estimate right there, 4.08. This is a bus driver. With an R-Naught of 4, it's an almost virtual guarantee that they then spread it if they were still on the job during the infectious days, driving people around, coughing it in the air, and doing all of that. And here's why it matters so much, because if we said that this bus driver, if you managed to catch them when they had just gone through one infective cycle, all you have to do is hunt down 4 people, isolate them. You can contain this virus. But if you miss it for a little while, well, now you've got 1,000 people to hunt down. That gets hard, if not impossible. Miss just one more cycle, and now you've got 4,000 people you got to go out and find, and that becomes truly impossible. So that's why it's really important to catch these things early, catch them often, don't let them get started. That's why proactive is way better than reactive. The WHO has come out and said we're going to be reactive, and that's no good.
别来公园串门啊！那个公园马上就封了啊，封锁了啊，药水什么的都开始了啊。
学把学堂俺们呢，就要娘封死来了，你给喊死来了。我去让咱们真的那个，学堂俺就别那个的，别那个他妈那是的。
还有是2.5啊？这是哪？来，给我那个啥，反正咱这本人看，你看，这个是我这个，我怕不知道你这个，现在什么好他个不光没得多3个，这他妈3个要去，他哪？我把它等下了底到这旁边。下一个旁边的地方。这个过去那种当回收那种。之前那个，我帮你有别的做别的都有，再过这个。